Hi, I'm Jason Troxel. Welcome back to the new normal. This is episode 2. Today in the news, quite a few things coming out about the healthcare sector, and I'm here to share them with you. Let's start off with Google's announcement that their healthcare API is now generally available for consumption. What's so special about this API? Well, Google's healthcare API is able to translate and convert data stored in different types of systems. And what that means is whether it's in Epic or Cerner, or whether it's in a imaging system or a medical record software of some other type, it's able to grab all of that information and then store that data on the cloud so it's accessible by the data owner. This technology is important because the government mandated as part of the CARES Act, and something they've been talking about for a while, that healthcare providers make it easier for patients to be able to use and access their health data. To date, some industry leaders like Epic and Cerner have had some restrictions around how data would be distributed or accessed. And this included some pretty draconian policies like we'll only send you printed copies or you can only get a CD-ROM from us. And in those cases, it's not electronic or not immediately accessible in real time, and both of those underserve the population. These rules are great. They were proposed last month by the Department of Health and Human Services, and they take aim at this so-called information blocking. So in here now we have the proposal requiring manufacturers to fashion software that can readily export a patient's entire medical record, and mandates that healthcare systems provide these records electronically at no cost to the patient. I realize that means there'll be a burden upon a lot of healthcare providers who haven't had to deal with this in the past. But overall, this is going to improve the entire industry, and it's going to give us maybe a better way to assess when we have pandemics like currently, because that information is now more broadly available and accessible for data mining. In recent years with in a recent interview with Kaiser Health News, Christopher Ream, he's the Chief Medical Information Officer at LifePoint Health, a hospital system in Brentwood, Tennessee, was quoted as saying, "A major remaining problem in wiring up medicine is the lack of interoperability across rival data systems." And boy, howdy. Having worked in health tech now for quite some time, we find this all the time when we're working with our hospital and healthcare customers, that if you are not in a certain walled garden, you're not able to access that data. Google's healthcare API solves this problem. These rules, issued by the Office of National Coordinator for Health Information Services, Information Technology, that's the ONC, as well as, and importantly, the Centers for Medicare and Medicaid Services, they advanced the goals for better record interoperability and patient access that were set in the bipartisan 21st century CURES Act. Okay, ONC requires APIs use the most recent version of Fast Healthcare interoperability resources, and Google's API does. The rule also mandates the use of implementation guidance to minimize variability, that means change and differences, and make it easier for different technologies to interact and exchange data using the API. That's great. That's actually exactly what the industry needs. A common set of translatable APIs that allow us to exchange healthcare information in a secure and still private and still personal way. So, as the old saying goes, where the head goes, the body will follow. And the fact that the Centers for Medicare and Medicaid Services have allowed or will allow patients to access their claims data through APIs is amazing. This is unlike other information sources. Claims data contains nearly every encounter with the healthcare system for an individual when they are covered by a health plan. That means this gives patients a broader set of information than they would obtain from a single provider. That's going to be a huge impetus and push in making these APIs take off and become standard. So also of note, the ONC rules establish the U.S. core data for interoperability, that's the US CDI, which will include a basic set of information such as medications and allergies, and details including address and phone number. These ONC rules make clear the EHRs, that's electronic health records, must be able to exchange US CDI data via standard APIs. So, as you can see, Google has positioned themselves very well in this. They're first to market with their healthcare API. They're first to be able to react to these changes from Congress. And this is all about patients. This is really about giving your data as a patient back to you. No other industry that I can think of, or no other environment that I can remember or recall, is in parallel to healthcare. I go into healthcare and all of my personal information belongs to them instead of me. If I choose to change a doctor, I have to go ask for permission to have my records. It's been a burden upon healthcare, and it has really obstructed better patient care. And I'm so excited about this rule. Now, I also want to mention that Techolution is a Google Premier partner and a global leader in Google Anthos implementations. So with our experience in launching applications in Google's HIPAA-compliant cloud, we can assist you in getting your medical practices connected to Google Health API and compliant with these new regulations. Please contact Techolution if you're interested at all. But more than that, there's more news today to discuss, and that's another huge topic to cover is ChartLogic has released a CARES Act cheat sheet, and I'm going to include a link here because in this post because I think this includes some of the most important information, concise and readable about the CARES Act in a way that's easily accessible. Let me go through it just a bit for you. They break it down into who's affected. We start off with hospitals. There's a reimbursement program of $100 billion allocated for public services to go to hospitals in the form of reimbursements for COVID-19 related care, usable toward things like building temporary structures, leasing properties, buying supplies, hiring and training additional workers, and increasing surge capacity. Surge capacity could also include some of your technology requirements. For Medicare and Medicaid, Congress will reverse scheduled cuts in Medicare and Medicaid reimbursements, effectively spreading an additional $11 billion across 3,000 hospitals. The CARES Act also provides for accelerated payments through the Medicare Part A and B. CMS outlines how the program works in the fact sheet and this letter to providers. So Medicare facilities are eligible, and eligible providers will receive a refund of 6.2% of their 2019 Medicare FFS reimbursements. That's great news. For clinics, Small Business Administration loans are available. The CARES Act provides for $350 billion in loans made available through the Small Business Administration for entities with fewer than 500 employees. The money is dispersed through one of two different programs. Let's take a look at those two programs. The first one is Paycheck Protection. The program offers up to $10 million to cover payroll and other expenses. Of note, the application process is still being managed by local banks, so contact a lender with whom you have a relationship. The application deadline for this is June 30th. Okay, there also, some or all of the loan may be forgiven if the company uses the money to retain workers or rehire those that are let go. It's huge, right? Free money. Retain or quickly rehire employees before the money arrives in an account and keep them there for 8 weeks, and the loan is 100% forgiven. Now, how easy it is to access money, if you have had experience with that, please hit me up in the comments section. I'd love to know. I know for small business loans for independent contractors and others have been maybe a nightmare, so we'll have to wait to see how well this works out. But what a great protection program. Second program that they talked about for the clinics was the Economic Injury Disaster Program. This extends SBA's program, which offers $2 million for disaster-related losses. Let me say that again, $2 million for disaster-related losses. The loans are made directly by the SBA as opposed to a local bank, and applicants can apply on the agency's website. The CARES Act makes the first $10,000 a grant that the applicant should have within 3 days. So real quick money to help you with your economic injury disaster. With the rise of COVID-19, the program now has more funds to work with and is relaxing some previous requirements, which is also good news. Another program here is Employee Retention Tax Credit. Instead of clinics, we're going to move on to Employee Retention Tax Credit. That's available for up to 50% of $10,000 in wages per employee. For clinics that have an outstanding SBA loan, the agency is paying principal and interest on existing loans and new loans taken out before September 27th of this year. All right. Last one they mentioned here in this ChartLogic cheat sheet was telehealth. And yesterday, of course, we covered telehealth in detail as part of the CARES Act announcement that provides $200 million for the Federal Communications Commission, from the Federal Communications Commission, to assist providers in using telehealth. However, since we talked about that yesterday, there's been a very interesting article that was published that covers how Cleveland Clinic rapidly scaled their telehealth program during this pandemic in just 8 short weeks. I found it to be a very interesting read. I'm going to include that link here as well. Again, I want to thank you so much for participating and watching here today. We'll continue to provide you the latest on this new show called The New Normal. So please subscribe and like our YouTube channel to follow us. Thanks so much.